Okay.
Hello and welcome to the Core 4 Momentum Podcast. I am Jessica Thompson, a physical therapist, passionate about women's health and pelvic health. And today I have the honor of interviewing my co-host, Amy Newberry. Hi, Amy.
Hey guys, how are you?
Great. Amy is a pelvic physical therapist, and she is also one of the hosts of our podcast, Core 4 Momentum, and administrator of our Facebook group. So today I get to interview Amy and just ask her about what is pelvic health physical therapy and how she got into it.
Cool. Awesome. I'm excited to be here as not the host this time, and roles are reversed.
Yeah, exciting. So Amy, can you just tell us what is pelvic health physical therapy? Let's start there.
Yeah. So pelvic PT, patients always ask me that when they come in, especially when they come in and they're like, I don't know what you're about to do. And so I always start by saying like, okay, well, it's still physical therapy. When you first think of PT, people will think of like, oh, knee repair or, just the basic like shoulder injury, stuff like that. And so I'm like, okay, we're a physical therapist. You're still in physical therapy. We're going to be looking at your muscles. We're musculoskeletal experts. So, that's what we're looking at. But specifically, the difference is that we're looking at your pelvic floor muscles. And your pelvic floor muscles are the ones that are the very bottom of your pelvis. And they help control, your bowels, your bladder, and sexual functioning. So I always try to make it sound less scary because I'm like, we're just looking at your muscles because they can play a big role in all those functions.
Yeah, that makes sense because physical therapy is physical therapy, and physical therapists, we kind of claim muscles as our organ that we specialize in. And I think a lot of people are just not aware that we have muscles in our pelvis, our pelvic floor. And so pelvic health physical therapists, they just specialize in treating that muscle group. Mm-hmm. And movement is their form of medicine. So pelvic PT.
Exactly. And it's like, they're like, oh, what are you going to be doing? And it's like, okay, well, I'm going to assess your muscles, but like, we're also going to be doing exercises and stretches like the way you would normally do. And you can use, like you said, like the movement and exercise to improve your pelvic health, which is crazy and cool.
Yeah, because I think pelvic pain and other forms of pelvic dysfunction are very common in society, but it's just not spoken about much. So what would you say is the most common conditions that you treat on a day-to-day?
Mm-hmm. So I just recently started working at a new clinic about 3 months ago. Before that, I was working at another place and I was the only therapist there doing it. Well, there was another one, she was part-time. But there I felt like I saw mostly like urinary incontinence, which is probably the number one thing people will think about when they hear about pelvic PT. But at this clinic I just started at 3 months ago, it's more established. They've had the program, the clinic's been around since I think 2001 or 2003. So
wow.
Pretty established. There's, I think, like 12 or 13 clinicians. So it's like really big, and the specialty is pelvic rehab and lymphedema. So I actually see more pelvic health patients, like a wider variety too. We have a lot of people coming in for like bowel dysfunction, which has been definitely a new thing for me, but it's been super cool. So in terms of like bowel function, I think the top things that I see would be like constipation or fecal incontinence. And recently I've had a lot of patients with dyssynergic defecation, which has been very interesting too. And then on the urinary side, like I said, urinary incontinence, super common thing for me to see. Also urgency and frequency of urination. So the people that are going all the time, all day, every day. And then the other side is like pregnancy and postpartum. So I see a lot of patients for dysfunction related to those life changes. It could be like pelvic pain, pelvic girdle pain. Oh, and pain with sex is a very, very common thing that I see also.
Wow, you just said so much, Amy. So it's definitely not, because I think people think of pelvic physical therapy and they think of just treating pelvic pain or just treating urinary incontinence, which is incontinence is leakage for people who are not familiar with that term. But so you also treat fecal incontinence and pain, people with different types of sexual dysfunction and bowel dysfunction. I mean, that's a lot.
It's crazy. Like when I first got into pelvic health, I had no idea how many different types of conditions that we could treat and see. So.
And let me ask you this. I know the answer, but I don't think our listeners will. How much of this did you learn in physical therapy school?
Oh, like very, very little. I think, and I know we've talked about this probably, but I think in my PT school, I had maybe like 3 lectures about pelvic health. And I mean, I was lucky enough to have an actual women's health certified specialist at my school, but even then we only got very little exposure to it. So really to learn all that, your pelvic therapist would have taken extra classes outside of PT school for continuing education. There are 2 like main bodies of, what's the word?
Certification, education.
Yeah, 2 main ones, like the APTA and Herman and Wallace. But yeah, if you go to pelvic PT, your pelvic therapist would have taken those courses outside of PT school.
So basically, Amy is so awesome, y'all. She was so passionate about this field that she went outside of physical therapy school and did extra and got extra education so she could be able to treat these patients. What made you passionate about women's health and pelvic health? Because you just mentioned this is a part of physical therapy that's not highlighted as heavily as other topics in physical therapy school. So what made you interested in it?
I think it was those lectures actually, those like 3 that we had. And it's funny because I think those lectures happened in my second year of school, but in my first year of school, when I went my first clinical rotation, my CI, my clinical instructor, she hadn't started her Herman and Wallace courses yet, but she was telling me that she was interested in it. And we had like one patient come in with like tailbone pain during pregnancy. And I remember my CI got so into it and I was like kind of cool, but like not going to do that. But then in my second year, when I had the lectures on it, I don't know, something just like clicked and changed. And I don't know if it was when my professor was passing around like the vaginal dilators or the vaginal weights, but I was like, what? Cool. I was like, that is so cool. And so at some point during those like 3 days, I was like, maybe this is something I'd be interested in. And I went and shadowed her a few days, like once a week or every other week, and saw her treat some patients. And I loved it. I mean, it was super like personal and like intimate and one-on-one, which is just kind of my personality and like something that like I thrive more in. So I think it just fit me very well. And then when I found out like, oh my gosh, we can treat these things. What? Like, why not? And it's just like conservative and it works. And it's just magic.
Yeah, you kind of answered my question that I was about to ask you, but I'll ask you anyway. So,
Okay.
What is your most rewarding part of being a pelvic health physical therapist?
I think, yeah, definitely. Like being able to help these patients get better in a way that they like literally had no idea that we could help them. Physical therapy is not on their radar when it comes to these issues and they have no idea. And then, their doctor refers them or they hear about it from someone else or they read it online and then they seek out the help and then it works. And especially when there's certain conditions that like urinary urgency and frequency that respond really quick to treatment. And it's like super cool because they come in the next time and they're like, oh my gosh, like it worked. And I only went to the bathroom this many times and I waited this long and I was okay. I didn't pee myself. And it's just like a celebration. And I had like one patient the other day, she comes in and she's like kind of like quiet about it, but I'm like, okay, like, how are you? Like, you know, she has dyspareunia, which is pain with sex. And I was like, so, did you attempt any intercourse? Like, how was it? And she was like, it was good. It wasn't painful. And she was just super calm about it. And I was like, how are you so calm about this?
Like you're doing cartwheels in your head, and she's just like,
Yeah, I was like, this is a celebration. Like, it was huge. And this kind of goes, and then I was like, I actually said, I was like, oh, like this is amazing. Like, you're so calm about it. And she was like, yeah, I guess I'm just like not used to like talking about this stuff still. And so I think that kind of goes into like another topic about pelvic therapy, just that it's like super personal. People aren't comfortable always talking about it.
mm-hmm.
But it's exciting and very rewarding.
Yeah, especially for, like you said, the patients where they can come back the next visit and they see results. It's just that instant gratification. That's like with any part of physical therapy. You always kind of anticipate like the next visit, and you know you're hoping that you get positive feedback from the patient and you can get that buy-in soon. So I'm glad that you're able to get that a lot with your patients.
Mm-hmm. It's super fun.
But you kind of mentioned something that I wanted to talk to you about. It's just that a lot of patients don't know about pelvic physical therapy, and when they get it, they are in love with it because it works. I mean, why do you think that pelvic health physical therapy is not very well known about?
I think it's because like multiple things. Like, one is it's just not talked about enough. It's definitely growing. People are talking more about it, but it's still not talked about enough. And that's just among like the general public. And then two, I think that medical providers don't know much about it either, like primary care physicians and OB-GYNs, or they don't like believe in it. So they don't mention it all the time. And there are some that do believe in it and have seen the results and do recommend it a lot, especially where I'm at, just because the clinic owner where I'm at, she's done like a great job marketing and talking and showing results. And so they believe in it. But in other places where it's not as established, I think the struggle is physicians just don't recommend it. And then patients go through this whole like cycle of different medical interventions, like injections, surgeries, just all this like stuff, medications, and they're on all this stuff. And then sometimes the last thing that they get to is physical therapy after they've already had all this stuff done to them.
Mm-hmm.
And then they're like, why didn't this happen like sooner? So I'd really say like, it's just a lack of information and knowledge out there.
Yeah, I agree. And I think just societal stigmas have a lot to do with it, because like you said, people just don't talk about any type of pain down there, quotes. People don't talk about that because it's not accepted. And so like you said, that's the main reason why it's not out there. But I think the need for pelvic physical therapy has not grown. I think people have been having pelvic pain for years and they're still having it now. So that's the same. But I do feel like the awareness of it has grown, but there's like a lot of growing to do. Because like you said, like the clinic that you work at now has been established since like the early 2000s, which is awesome. And I think more and more practices who are primarily like orthopedic now are like pulling in therapists who specialize in pelvic health, because the awareness is growing. And there has always been a need for it, and there still is. So
Yeah.
I am happy that the awareness is growing, but I know that there's a lot of work to do. And I think, we have to kind of create a safe space for patients to be open and honest about what they're going through, and to be able to share that with friends and family so they can know that they can get the help. But as clinicians, I think we could do a better job with research and having more stuff to back up what we know is true, so that more providers can believe in it, and more people can get the help that they need.
Mm-hmm.
Can you tell us, because I know there might be somebody listening who is like, wow, this might be something that I need.
Mm-hmm.
Can you kind of tell people what to expect on their first visit to see a pelvic health physical therapist? Because I know you've had experience working in a clinic that wasn't primarily pelvic health, and now you have experience working in a clinic that is primarily pelvic health. So like from when they like walk through the doors or like call to make up their appointment, like what can they expect the process to be like?
Yeah, and I think that definitely depends on the therapist you go to and the clinic you go to. You probably, let's say you get your referral or you like self-refer yourself depending on like what state you're in, and you start for your first day and you show up. Typically there will be some sort of like intake form that you have to fill out first of all with some questions on it. At my old place, I had an extensive questionnaire asking about all like bladder, bowel, and sexual function types of questions. So, and if you don't have a questionnaire to fill out, your therapist will ask you in the interview when they're first getting to know you. So be prepared to answer all those personal questions. Don't be afraid to say it because like we need to know those things. I'll have patients, I'll be asking them questions and then they're like, oh, like, I don't like, I guess I should say this, but blah, 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 blah. And I'm like, yeah, please tell me because this is all related to like what's going on. I need to know all of it. Don't like hide anything. So that's the first part will be lots of questions. The second part will be the actual exam and it'll consist of an orthopedic part and likely an internal pelvic floor assessment. So the orthopedic part is like your typical PT thing, just seeing how you move and your strength in general. And then the internal part is always the part I try to prepare people for. I'll like let them know and so before we even do it, I have like a little pelvic model and I literally will walk them through what I'm about to do so that there's no question and that they're not as like afraid. And obviously you don't have to, if you're a patient, if you don't want to do it, you don't have to. It's totally a consent thing. Like if you're okay with it, then it will help us a ton with information gathering. But if you don't want to do it, you don't have to. So we try to make sure patients know that they have a choice and like they're in control. If at any point in the internal assessment you want to stop, that's a completely fine too. But then the internal part is, it's kind of like when you go to your OB-GYN and they do like a pelvic exam, but it's not as invasive because there's not a speculum or anything that's involved. But we'll check your pelvic floor strength by having you do like pelvic floor contractions, see if you have any pain, and check all of those different things.
So how do you check them?
Okay. Like internally.
Yeah.
It'll be like an intravaginal assessment, usually if it's a female patient. If it's a male patient, it would be an intrarectal exam, or if it's a female patient with like bowel issues, I'll do an intrarectal assessment. So it involves just one gloved lubricated digit inserted. And yeah, so that's how you would check the actual strength and for pain. You can also just check the perineum. So by looking, you can get a lot of information from just looking to see if there's any muscular tightness, how the range of motion is. So you check range of motion by seeing if someone can contract their pelvic floor muscles and relax and see if they can like bear down, because it's important to have a full range up and down, which most people don't think about that, the full range. I hope that answered the question.
Yes, it does. I was just trying to think about it as someone who had no idea what it was. So I think you explained it very well, like top to bottom. So do you do internal assessments or internal treatments every visit with patients, or does it depend? What are follow-up visits? What do they look like typically?
Yeah, it definitely depends on the diagnosis or what they're coming in for. Typically, if it's like incontinence, we don't have to do internal every time. But if it is like dyspareunia, so like pelvic pain, a lot of times we will do internal mostly every session for at least part of it. And then the other part is doing exercises. But I try to tell people like, like upfront, if it is going to be a lot of internal doing, like it is what it is. Like there is going to be, like a digit inserted and they'll be stretching and everything. So, And yeah, so it just really depends. But I still try to be as like listen to the patient as much as possible. So like if they really are uncomfortable with it and I can get that vibe from them, and I'm like, okay, like we're not going to do it today. So definitely every single treatment session that they come in, I'll like ask them like, are you okay if we do this today? This is what I was thinking. Like, what do you think about this? Just to get their input.
Yeah, that's good. I think you explained that very well for people who were wondering what pelvic health physical therapy looks like because they had never even heard of it in the first place.
Yeah. I guess like the biggest thing for people to know is like the biggest difference is like there likely would be an internal assessment. And I think that's an important part of pelvic PT because it's really hard to know what's going on down there if we can't check. So, I mean, obviously it's up to the patient, but it is very helpful for, I guess, us as the clinician to be able to like treat them if we know what's going on.
I mean, right, because if I went to a physical therapist for my ankle pain and they never touched my ankle, I would be like, what's up?
Yeah,
you didn't look at it. You did not. You don't know what's going on. So it makes sense, and it may be awkward the first visitor, so, but it definitely makes sense that it has to be done, and I think pelvic health physical therapists do a good job with building rapport with patients and creating a safe space for patients so that it's really not awkward once you do it. So
yeah, and a lot of patients at the end, they're like, oh, that wasn't as bad as I was expecting, or they're like, oh, like I actually feel pretty comfortable. So it's always an accomplishment. I think that's whenever patients say that, I'm like, yes, accomplished.
yes, because it's so important for patients to feel comfortable with you treating them. So
Especially such a personal thing.
yes. Okay, Amy, do you have any other tidbits that you want to share with our audience about pelvic health physical therapy?
I think the only thing would be like if you think that you might have a problem, either like with your bladder, with peeing, or with pooping, or with sex, like definitely reach out and look for a pelvic PT because there are every day might be an exaggeration, but like every week more and more people are becoming pelvic PTs and growing, and just definitely like reach out and get some help if you think you might have a problem because you don't want to ignore it because then it just can domino into more things in the future. So like advocate for yourself when you go to your physician, and you have a voice like in your care. If you want to do like conservative stuff first, then do it. And there's lots of ways you can look for pelvic PTs. You can go on Google. There's like the Herman and Wallace site, the APTA site. There's lots of resources out there.
Yes. Empower yourself and advocate for yourself. I love it. And like Amy said, it is, regardless of what you're going to see a physical therapist for, it is always so much more easier to treat something acutely than chronically. So if when something happens, say something and get the help that you need then, and don't wait until you get to the point where you can't ignore it.
Yeah, I've had some patients come in, they're like, I've been constipated for 15 years. And it's like, whoa, okay, we have a lot of work to do.
And as a patient, be aware that if it took you a long time to get to physical therapy, your process and seeing benefits may take a longer amount of time as well, possibly. So just be aware of that.
Yes, for sure.
Yes. Set those expectations.
Mm-hmm.
But thanks, Amy, for mentioning the ways where people can find pelvic PTs through the APTA, Herman and Wallace, or simple Google search. We will kind of put some links to websites to find pelvic PTs in the notes for this episode of the podcast. So thank you again, Amy, for sharing your knowledge and your experience as a pelvic health PT with us. And thank you for the service that you do every day.
Thanks. And just get the help you need. And there was one more thing I just thought of. In honor of trying to raise more awareness of pelvic health and have people know more, I want to challenge everybody that's listening to talk to just pick one person and talk to them about like what you learned, or just tell them about pelvic PT. You don't even if you don't have any personal like pelvic health issues, just be like, oh, I listened to this really cool thing and I've learned about this. And, maybe the person you talk to will be like, oh, that's something that I have, like constipation, incontinence, pain, anything, and just help like raise awareness there. So that's your challenge. One person.
I love it, Amy. We're ending this episode with a challenge. Let's pay it forward and do what we've got to do to get more people the help that they need. Thank you so much, Amy.
Yeah. Okay. Thank you for having me.
You're welcome.